Hi, everyone, and welcome to the special simulcast of the Neil Haley Show and the Reset Medical and Wellness Podcast. I'm your presenter, Neil Haley. As always, we have a great guest, but we have the one that we wish could host all the time. But he is busy helping so many people. Dr. Louwers. Dr. Louwers, thanks again for stopping by in this conversation on your podcast. And, and
Absolutely.
and we're happy to have you on to talk about specifically the difference between, because I always ask you this,
Yeah.
NSR and
And
SBG,
SGB,
SG,
SGB. Yeah, you got
SGB.
it. No,
What's the
that's
difference? Because I think what you provide is so different in the way you perform it, but also the way your feedback. As I've been talking to many people on the podcast in the last couple months.
yeah, and we get that question. And it kind of stems back to first off, how this was discovered, right? So uh SGB, sympathetic blocks, have been done for 100 years, primarily to help a specific type of nerve pain. And well, lo and behold, in the 1990s, they found that they were doing this block for patients that had phantom limb pain. If you're not familiar, that's when you lose an extremity and you still have pain in that limb, even though it's not there. And of course, there's a lot of overlap with that condition and post-traumatic stress. And these patients were getting improvements in their post-traumatic stress symptoms. And so they began to look at this about 25 years ago as a treatment option for anxiety disorders, stress, and trauma disorders. And it showed obvious benefit. Some of my predecessors have looked at this and said, how are we going to get the most out of this block? What's the basic science behind it? What's the anatomy? How can we, optimize the outcomes? And they did a really great job looking at that research of how to essentially perform this injection in the optimal way. And that's the first step, right? So doing this block at it as it had been done 20 years ago is insufficient. You really have to do this block using ultrasound to get your best outcomes for safety and efficacy. Um, and it has to be done in a specific way, targeting two levels along that nerve. Um, by doing these two levels, you get a more profound benefit. And that's kind of where they've left it. And where I'm taking over is sort of the evolution of that, which is understanding, okay, now we know how to do this block. When do we do it? And how do we incorporate that into the bigger picture of post-traumatic growth and trauma recovery, right? Because I think that can really take it to the next level. Beyond just getting some benefit, we're talking about really sustaining permanent benefits. And so the way we do it incorporates a trauma-informed approach, right? The setting that we're doing it in, I think, is equally as important as how you do it, and also integrating treatments afterwards, right? Maybe more traditional treatments like talk therapy or mindfulness practices, and educating the patient on how and when to do those, again, equally as important as the block itself. And that's where neurosympathetic reset is really different than your traditional stellate ganglion block or SGB. We're taking it sort of to that next level. We're taking it to the point where now patients are getting this block and having really sustained benefit for much longer, and we're seeing better and better outcomes.
So do you feel it has to do with approach, or do you also in the way you do it? I'm just asking that question because I'm trying to figure,
Yeah, I
how.
think it's
Yeah.
both because I mean, look at what the patient population you're dealing with, right? You're dealing with folks that have horrible anxiety, that have often been traumatized by physician care or by medical care in the past, right? And now they're coming in to have a procedure done on their neck, which is, to be honest, a uncomfortable area. And if done in the wrong way, that's just going to provoke anxiety, right? And there's a right way to do that and a wrong way to do that. And so doing that in a setting that's comfortable, that's welcoming, that's warm, that's calming, essentially the definition of trauma informed. It's about making sure that the patient has control through that entire process, right? And in doing so, you're empowering them to, to connect medical treatment with safety, but also you're helping their nervous system and restoring that balance that's so needed so that they can progress beyond this.
Interesting. And so, in a lot of ways, that you saw this SGB done before, that you see the challenge
And
that your patients would have if done
if
differently.
done previously, yeah, and we still see that. So, unfortunately, right now, there's a lot of centers out there that are doing this block primarily for pain, but then occasionally for mental health, right? And if you've ever had any injection for pain, a shot in your knee for arthritis or an epidural in your spine, you'll probably know that most of those centers are very volume driven, that I hate to use the term production line, but there's a lot of centers that have that mentality. And maybe it's not the provider's fault, it's just the business as a whole, the hospital system has forced those providers into these quick treatments. And again, if you're doing that for someone that is struggling with anxiety, you could be causing more harm than benefit, even though
Right.
you're doing it with the right intention, right? And so yeah, we're seeing that still today, that this block is being done in that setting without that integration. That doesn't mean that they can't have benefit. I mean, they certainly could, of course, and a lot of folks are, which is great. I love that. And the more folks that we can help, the better. But if you really want to do it in a way that is optimal, I think that that's what we've established here.
In the rush mode, here you go, factory system. We had you scheduled for an hour and you're out, or it's post op and you get to meet with the doctor for 3 minutes.
Right.
That system doesn't work for long staying growth
Response.
response.
Yeah.
And also how you therapeutically do it in a lot of ways. It's done in a
Correct.
way that is not giving anxiety to the patient, because the people you're serving are not for pain. Pain will help, but you're
Right,
serving
right.
you're
We're
serving them for
serving
another
for
reason.
we're treating a different diagnosis. Yeah, and of course, simply the technique too. I would add that in as the third thing. Established again on the basis of how this has been optimized in the past to get the best benefit, and not everyone is trained in that specific technique. So it is a combination of technique and setting and integration into the kind of that bigger trauma-informed care.
It's very interesting when you bring this up, because you don't literally think about uh those areas when we talk about the difference between the two. And those are just, but the last component I think is the most important. Your follow up with patients, we've talked
Yeah,
about on the podcast before.
yeah,
You're explaining, if this treatment's done, you still have to follow these steps for it to last longer, a
yeah.
longer period of time, sometimes for a lifetime. Some people.
Yeah. And we talk about this, Neil, as a catalyst, right? I mean, I think you and I have said that before, but that's what it is. It's giving you an opportunity to really engage with effective treatment beyond this, right? A lot of people come to me and they talk about how they feel they want to go in this direction, but their body is kind of forcing them to respond in this direction. And they can never make progress because these two lanes are always diverging. And if we can get them to a situation where they are in control of how they respond to a situation, where they're in control of their physiologic response to stress, then they really start to see the progress, right? Then they can really start to move forward. And that's what we do. And I think that's really the biggest takeaway.
Because when you have these conversations, then it's kind of like preparing them for after. You're going to not react the same way. However, with provoked, you will get to that certain point. So, what types of ideas do you have? What strategies do you have? And going through talk therapy or finding other activities to do, you're able
Yeah.
to identify, okay, when I get to this point, at least I'm not controlled that I'm going to react this way. I'm going to go down this spiral because I'm not in this fight and flight mode anymore. So I can think about this. I can feel and say, okay, this is the decision I should make. And that's where you're really
Yeah.
explaining that to the patient before the
Yeah.
procedure and after.
Yeah, and you've created this space for them, this window of opportunity so that they can do that. And the also the takeaway is not everyone's the same, right? One person is going to be real responsive to, a specific type of trauma therapy. And maybe another person is really responsive to more mindfulness practices and breath work and meditation. And maybe for someone else, it's about healthy coping strategies and changing their lifestyle. But the key takeaway there is while there's not one perfect algorithm, it's about those lifestyle changes, right? It's about making those changes. And that's true in any medical treatment, right? When you when you look at blood pressure management or GI issues or whatever it is, it's not just about here's this treatment or here's this pill. It's about what lifestyle changes are you going to do to incorporate this and maintain this benefit that we're giving you. And it's all the more important when you talk about mental health to do that.
So let's talk about the follow-up, how your team follows up with someone. That's such an important thing,
Yep.
right?
So absolutely. So yeah, so we follow a patient monthly for the first 6 months. Calls or whatever way we can get a hold of you, maybe an email or a quick text. But that's not just to just check in on you. Of course, we're doing that. We want to know, of course, if you have questions, but most importantly, if you need those resources. So over the last few years, I've established resources all around the country, from, therapists to holistic practitioners, functional medicine, yoga instructors, whatever you might need. I likely have a resource, and I'm not, financially associated with these, but I just want my patients to have that ability to connect with providers that are really going to help them move forward. And maybe you already have that connection. Maybe they already have a great therapist, and that's wonderful. I'm all in support of that. But a lot of folks don't, or had given up on therapy, or had given up on this or that. And I want to take this as an opportunity to reconnect them with those folks that are going to get them the best possible outcome after our treatment. So that's what we do in those first 6 months. We also follow objectively with measures of success that I use also for research. So assessments essentially that track things like post-traumatic stress scores, anxiety scores, depression scores. And then we can use that again, both for research, but to see objectively, hey, this patient is 50%, this patient's 60% better. And we track those out 2 years. So we want to again see that while this isn't going to, be a permanent solution for everyone, it's not even going to be a solution for everyone. It is very effective in a high percentage of patients, and we're trying to show that it can be optimized so it really can last a long time. For many, something that can be permanent.
And Dr. Louwers, what you're able to do, which is not your core skill set, is talk to the patient, really provide a little bit of that therapeutic area in conversation, which many doctors do not do.
I think, yeah, exactly it. I think that's missing in medicine, right? I think, 100 years ago, that's probably what medicine was. I mean, they didn't have the technology that we do, right? But they just connected with their patients. They listened. They took that time. Your primary care was probably also your OB-GYN and your surgeon and your endocrinologist and your cardiovascular doc, right? Now those are 10 separate doctors, so they only have, 5 minutes each. But if you can really connect with a patient and just listen to them, I think that in itself is healing. That's you can call it a placebo effect there, but I think just listening to your patients is step one. If you're not doing that, whatever treatment you do after that is not going to have the most optimal outcome. You might help, but it could be better.
Anything else to close out this podcast that you want to add?
Oh, well, it is Mental Health Awareness Month in May. So I think it's a time to sort of, reflect on those that might be struggling, reflect on our own thoughts and intentions and goals. And if you recognize that there are folks, family members, friends that are struggling, to reach out because it's not always something that someone might recognize until it's gone too far. So it's a good time to just be aware of mental health and and acknowledge that in friends and family.
Best place people can go if they want to schedule a reset.
Yeah, so our website, theresetcenter.com, is the best place to go or call 877 Reset 10. But our website has, of course, all the information you would need on it. We go over all our treatments. We talk about how they work. There's a lot of research on there. There's testimonials on there from other patients and individuals that have been treated. Um, so that's probably the best place to start, theresetcenter.com.
All right. Thanks a lot, Dr. Louwers. Appreciate it.
Absolutely, Neil. Always a pleasure.
All right. That was a special simulcast of the Neil Haley Show and the Reset Medical and Wellness podcast, guys. Take care. We